CGTN has prepared a series of features exploring its implications on the African continent. We continue our series today looking at the impact of COVID-19 on travel. Here's CGTN's Lindy Mtongana.
Yes, indeed. The airport is the main port of entry for large numbers of travelers from across the globe. Our reporters in Kenya and Ethiopia sought to find out how COVID-19 is impacting this important sector. Now, despite the challenges posed by the COVID-19 outbreak, Ethiopian Airlines continues to connect its customers globally, including through its 35 weekly flights to China. But how is the airline keeping its passengers and crew safe? Well, CGTN's Girum Chala got exclusive access to the Ethiopian Airlines operations hub and filed this special report.
It's business as usual here at Addis Ababa Bole International Airport. Almost all flights from Ethiopian Airlines, major destinations from Europe, America and China have touched down. In a normal scenario, after disembarking from the plane, passengers line up at the customs. But now more measures have been put in place. So let's see where these passengers are headed now. And the first thing to do is to get registered. These passengers need to also tell all of these people, the health workers, where they came from, so that the health workers can establish the whereabouts. Everyone that comes in and out of the airport gets a temperature test through manual and computer-assisted device, as can be seen here. This is due to the coronavirus outbreak. And as I have also stepped into the airport, I have to get checked as well. Thank you. The screening is also done on all crew, but this is not all. All aircrafts which arrive from corona-affected destinations get disinfected before they fly again.
The prevention is done in accordance with the guidelines prescribed by authorities, and that has been done not only from Addis but from origin. The passengers will be checked for their temperature upon departure, and then they will also be inspected on board. And when they arrive, they will be tested upon disembarkation of the aircraft. And then again, when they enter into the terminal, they will be checked for again to assess their temperature. And then again, once they transfer, if they are transfer passengers, they will be going direct to the transfer area. If they are entering into the country, there is another control, which they would be required to fill a form to be submitted to the Public Health Institute officers, and then they will be under follow-up for 2 weeks.
I think there's whatever in China, maybe in Beijing and the Ethiopian, maybe in this city, do some more work to prevent the COVID-19, and thanks to the government for doing this one to protect the people's health like this.
It's amazing. I should say that all international airports should have the screening methods, and maybe to prevent the coronavirus from getting in.
I think this is the normal policy for the control the coronavirus, and this is good things for passengers to control this, not spread the virus to everybody. Yeah. I think this is good.
On average, Bole International Airport serves at least 29,000 passengers daily.
The decision to fly to China comes after evaluating the assessment and the conditions. Stopping flight to China doesn't paramount to preventing the disease, the virus disease. So what we do is we do all precaution measures, and we continue to fly China.
The world is a global village, and movement is inevitable. Therefore, containing global epidemic outbreaks is increasingly becoming a challenge. It is then critical to take such precautionary measures to ensure safety of travelers all over the world. Group Jala CGTN, Addis Ababa, Ethiopia.
Ride-sharing apps have gained popularity in Africa, with scores of customers using the services to get from point A to point B. But how exposed are drivers to the coronavirus? CGTN's Astatal was on the ground when the first case in Kenya was confirmed. She followed up with the driver to get his real-time reaction to the development.
On March 13th, Kenya confirmed its first case of COVID-19. Kenyans and millions of Africans use ride-sharing apps. Drivers interact with many passengers throughout their day. Let's order a ride and see if they're taking any precautions. Hi, Ken. Yes, I'm right here, right before the main road. You should see me. Okay, all right. See you soon. Hi, Ken. How are you? I'm good. I'm sure you've heard about COVID-19. How have you been feeling about the developments?
I've heard of it. It's spread in different countries. At least recently we just heard it's now in Kenya. So it's kind of scary now.
Are airport trips a big earner for you?
Yeah, okay. For us, we take them like long trips, which at least give us good earnings.
And will you stop going to the airport now that there's a case confirmed in Kenya?
At the moment, yes, I need the money, but because of the disease, I'm kind of afraid. I'll limit my trips to the airport.
So, typically, how many times do you wash the car?
Okay, on my case, I always clean it on a daily basis. The general car wash. But for the sanitizers, we haven't tried it yet. But now that the case has been reported in Kenya, I'm going to be doing it on a daily basis, or each time I pick a new client. See, it's so scary because we all have families back at home, and you see the kind of job that I do, I have to be out here to work so that I feed my family. And back at home, you see, if I'm affected, it will basically scramble my financial life, and I'll not be able to feed my family.
Like Ken, many of us use cars to get around in our daily lives. Here are some measures you can take as a driver and passenger. Cars have many frequently touched surfaces. These include door handles, steering wheels, dashboard controls, passenger and driver door armrest. To clean your car interior, you will need disposable gloves and a microfiber cloth. Soap and water can still be used to clean your car. For sensitive surfaces like touchscreens, automakers like Toyota advise to use bleach-free wipes with at least 70% alcohol in them. When cleaning your car upholstery, experts suggest lightly agitating the fabric with a small amount of water and laundry detergent. If you're a passenger in a taxi or a car, you can also take measures to protect yourself. If you want to avoid touching surfaces like door handles, you can use a tissue. For general safety, security experts advise sitting directly behind a driver. In the event your driver coughs or sneezes, you're less likely to have droplets land on you. It's advised to use hand sanitizer or soap and water to keep your hands clean before, during, and after the ride. Astatal, CGTN, Nairobi, Kenya.
Meanwhile, Kenya's transport authorities have called on operators to ensure the safety of the millions of Kenyans who use public transport every day. CGTN's Astatal spoke to one such public service vehicle operator.
As COVID-19 spreads around the world, governments are looking at the risk posed by public transportation. Here in Kenya, millions of people use buses, locally referred to as matatus, to get around. The Kenyan government has published a list of directives for matatus to follow to ensure the safety of passengers and drivers. Let's see what the reality is like on the ground. The directive published by the Kenyan government stated that matatus are meant to be washed and disinfected twice a day. Sanitizers are also meant to be made available to passengers. In the capital, Nairobi, matatus are complying with some of the measures.
The challenge is on follow-ups. I have to supervise whoever is on duty to know whether they have done it or not.
According to Abdi, the buses are fully disinfected and washed at night.
We were lucky to get the chemicals. You have seen the containers, we have enough. So I can't say it's a challenge to get them. We got them and we were lucky. But I don't know if we are going to be getting them in the future. We have them right now, but in the coming days, like next week, I don't know whether we will find them.
On board one of the super metro matatus, Peter Urungu, a driver, takes measures to protect himself and his colleagues.
As drivers, we use this sanitizer to wash hands. When you board, you wash your hands. When you alight and swap with another driver, you wash your hands. Spray the steering wheel, on the handles, glass surfaces and door locks, because when swapping shifts, maybe someone did not wash their hands, then they leave the bacteria on the steering and then you come and touch it. So when you get in, you wash your hands and put the sanitizer back.
On board, passengers have mixed reactions to the spread of COVID-19.
Okay, we fear about it because I don't know who's sitting next to me. I don't know whether he's having corona or what. I don't know how safety he is, so we are afraid of it.
We are a bit worried, but we have a confidence that the government will work on it.
While some passengers continue to use matatus, as more cases get reported in Kenya, business has been affected.
There is no work, it's very little. Initially the buses made money, but not now. The flow of passengers is very low. There are very few passengers.
Social distance.
On March 22nd, Kenya's Cabinet Secretary for Health underscored the importance for buses and trains to follow a directive published a day after we finished filming.
All public service vehicles must adhere to the directive issued on Friday, March the 20th, failure to which the respective SACCO licenses will be revoked.
On a follow-up call, Abdi explained while Super Metro is now following the new guideline, they've had to increase the fare in order to compensate for carrying less passengers. Since its launch, Kenya's standard gauge railway continues to carry passengers and goods through various counties. And as COVID-19 spreads, SGR has taken special measures, from screening passengers' temperatures to making sanitizer readily available.
Yes, the station we are disinfecting very early in the morning before the passengers come in. We are making sure that the station is disinfected. And then most of our passengers start coming in the stations from around 11 o'clock. That's Nairobi and Mombasa for the main stations. So we ensure that we disinfect the stations once more. Later in the evening, because then we do have passengers coming in, both in Nairobi and Mombasa, we disinfect it and then back the following day for the same cycle of carrying out the cleaning and the disinfecting the stations.
If a passenger records a fever, they're isolated in a separate cabin. The trained instructor then takes charge to ensure the proper measures are being followed.
After that, I'll just communicate to the office in Nairobi of the situation. And along the way to Mombasa, maybe in Tande, we have intermediate stations along the way. So they will make a stop in the next intermediate station, and an ambulance will be at a platform and it will transfer to the hospital.
Staff on the SGR handle many passengers with each trip. The SGR has made sure they're properly equipped to safely provide the necessary services to customers.
For the staff, we've made sure that all the staff pass through the same entrance where the screening of the temperature is done in the morning by the security people and the people from health. And for the staff, we provided them with masks and gloves each and every day. And for passenger service department, we also have the temperature scanning machine so that I can scan my staff after every 1 hour to ensure they are okay.
At the end of each trip, trains are properly fumigated and disinfected. Surfaces are wiped during and after each trip. SGR's managing company, Africa Star Railway Operations, also remains in close contact with government bodies to ensure their guidelines remain up to date.
We are also working very closely with the county governments, both Nairobi, Voi, and in Mombasa. And in fact, in Mombasa, in the committee crisis meeting, we have representation in the committee so that we are able to deliberate, give an update, and we are able to be informed of the status and what other measures that we need to put through to assist and ensuring that we ensure that the virus does not spread.
Among their updated measures is respecting the Kenyan government's guideline to ensure that trains are only operating at 60% capacity in an effort to practice social distancing. Astatal, CGTN, Nairobi, Kenya.
In today's Voices of the People segment, we find out how Africans are protecting themselves from getting infected.
I put water and soap outside my home to protect my family from coronavirus. Everybody washes their hands, from my wife, my kids, to all my visitors.
I wash my hands and I use hand sanitizers all the time. So that's how I prevent it.
I'm trying, at least in the public places where I go, restaurants, sanitize as much as I can. Make sure even when I cough, I'm like, oh, I take control measures, do my natural remedy of take the garlic.
My name is Melanie Verwoerd. I'm a former Member of Parliament for the ANC in South Africa. I've also been South Africa's ambassador to Ireland, and I worked for UNICEF as Executive Director in Ireland for a couple of years. For the last week and a half, my family and I have lived with the COVID-19 virus, or coronavirus as they call it. My daughter first contracted it a week and a half ago. We think from foreign guests that we engaged with, we don't know. And my son was then diagnosed positive with it as well shortly afterwards. I'm still waiting for my test results, but we're presuming that it's positive since I had all the same symptoms as them. We, of course, immediately isolated ourselves. We did not have any contact with people at all. So for the last 2 weeks, we have been on our own, or week and a half, since we became ill, even before we got the tests. My daughter in particular was very, very ill. She developed a very high fever, over 39 degrees for 4 days. She developed a very bad cough, tight chest. We also, for all of us, the disease started with diarrhea. And we also lost our sense of smell and taste. But I think it's very important for people to realize that the symptoms can differ very much. My son and I, for example, had a sore throat, but had no fever. I felt like I had a very bad cold. He didn't even have those symptoms, and yet he was positive. So it's very important to realize that the symptoms can differ vastly, depending on how strong your immune system is. And I think that's the big takeaway for us. This is the big thing that we've learned in the last week and a half. We have to stand together now as people in our communities. And as Africans, we are good at that. We do like to take care of one another. In South Africa, we talk a lot about Ubuntu. And this is what we really need to be good at the moment. Even though we shouldn't physically touch people, even though we shouldn't be very close to people if they are sick, we still need to take care of one another. We need to make sure that we know where there's elderly people that they are okay. We need to give our neighbors who are sick, we have to leave them food at their doors. We need to make sure that we don't now turn on one another, but in fact that we actually start taking care of one another.
How much do you know about COVID-19 and the precautionary measures to take? Well, join us tomorrow as we explore matters of public awareness.